This is a plain CT scan of a 37 years old female patient. This was done about 9 months ago. The patient had her last cesarean about 9 years ago. After the cesarean, the patient had a feeling of mass in lower abdomen and a constant pain. Now this is the mass here. This lies in the mesentery. It is well defined. Now patient is harboring it for the last 9 years after the cesarean surgery. Her uterus and ovaries are normal. Now I will show you her contrast NAN CT scan. This is the contrast NAN CT scan. Now well defined mass gland here. This shows thin marginal enhancement. Its inner medium has non-homogeneous texture. At places, lucent areas are noted inside it. These one like here, but these are too tiny. I called the patient for ultrasound. This mass was brightly echogenic, so I suggested the diagnosis of a Gossypiboma. The patient was operated upon, and Gossypiboma, it was retrieved. It was lying in the mesentery. There was no involvement of intestines. After the surgery, the patient remained symptom-free for quite some time, but she developed anterior abdominal wall hernias. Patient was operated upon twice for the anterior abdominal wall hernias, and the mesh was placed. This is the region. Now again the patient has developed pain in right lower abdomen. Now this is her current CT scan, which was done few days ago. Now please observe slight gut wall thickening here. This involves distal ileum. This one here. The density of adjacent mesenteric fat is increased in this region. Please observe these areas here. Mucosal prominence and prominence of the valvae conniventes. So there are two possible reasons for these appearances of the mesentery and the terminal ileum. One is the inflammatory lesion and the other is the small gut ischemia in this region. Now please observe that the previously described mass lesion is no more visible, which was removed about 9 months ago. Uterus and ovaries are normal.